Does it impair that judgment, do you think? Raise your hand if you agree with me. Real high. Look around the room. Okay. All right. I disagree. I'm going to step over here just to make the visual point. If I am the person with mental illness who does not believe he's ill, I'd be an idiot to listen to you. I mean, we're talking about fucking aliens here, motherfucker. You out of your fucking mind? I'm going in that ambulance? The only safe place is in my house, where I've got the aluminum foil on the walls. Anyone encountered this guy? I have. But he was terrified. It's not common sense. In his mind, it's common sense to get back in the house, where he was screaming at his mother and terrifying her, and that's why she called 911. How many of you would inject yourselves with insulin if you did not have diabetes? You don't have diabetes, would you inject yourself with insulin? Raise your hand. No hands are going up. Why? Why not? I'm sorry?
You're afraid it's going to make you sick.
You're afraid it will make you sick. Insulin can kill you if you don't have diabetes, by the way. You ever hear this from patients? I'm not taking the medicine, it's poison? I have many times over. By the way, how many of you have heard, I'm not sick, I don't need help? Raise your hands. Real high. Look around the room, keep your hands up. Look around the room, keep your hands up. Everyone's hands are up. Maybe 3 or 4, maybe 10 people aren't. Yeah. No, I didn't ask you if you personally would make that statement, if you've heard the statement. It's a common problem, right? You've all heard it. You're not even most of you are not mental health professionals. How many law enforcement officers in the room? Okay, how many mental health professionals? Okay, any consumers in the room? So I'm the only person that's ever received psychiatric treatment. Wow. I don't want to diminish the stigma, but I was treated for depression, and I think it's important for those of us who are comfortable talking about it to admit to it. Because that's how we're going to solve this problem, is by working together and being frank with each other about it. But it's not common sense to take medicine if you don't think you're ill. It's not common sense to comply with the police officer's request necessarily if you think you're ill. I'm sorry, if you don't think you're ill. In fact, it could be foolish. It could be dangerous depending on what your delusions are or what the voices are telling you. Don't listen to him. He's part of the conspiracy. Don't listen to her. She's the devil. She's the devil. Well, common sense is run the heck away from that police officer. But are we dealing with denial? We're not. The research shows that in most of the people you're encountering with these illnesses, particularly schizophrenia and schizoaffective disorder, what we're dealing with is a neurological syndrome, another symptom of the illness called anosognosia. I'm sorry, it's a tongue twister. I did not invent this. This was first described by a neurologist in 1919, where he would describe stroke patients who were paralyzed on one side of the body and they didn't know it. Imagine being paralyzed on one side of your body and you do not know it. Some of you may have encountered this maybe in relatives after stroke. There's a lot of research on this. I'm not going to get into it in detail, but I will come back to this briefly. And it makes a big difference in how family members perceive and how you perceive the person. I mean, you wouldn't tell someone to stop hallucinating, would you? Anyone here do that? I haven't. Why not? Why wouldn't you? Listen, I know you're hearing voices, but just cut it out. Why not? Because you can't. They can't. You understand it's not under their control. And yet, I said to my brother and to many patients, now come on, the evidence is clear, you're mentally ill. Cut it out. I mean, you got to admit it. I mean, that's a little harsher way that I would say it, but I would say it gently too. If you think of this as a symptom, if you know it's a symptom, it really helps you with your communication strategies. You won't get caught up in trying to convince the person they need to go to the hospital to get help with their emotional problem. You got to assess, you got to know if this person even thinks they have mental illness, because you're going to get a lot of resistance. So what's the research tell us generally about this problem of anosognosia? This is a study from 1989 to 1990. You all know what the DSM is? Anyone not know what the DSM is? Okay, DSM-4, good. You all know. I was co-chair of the last revision of this for the schizophrenia section, but back in 1989 I had different roles. I was an advisor. I worked on a big research study we did all around the country. We found about 60% of patients with schizophrenia did not believe they were ill. Only 40% thought they had a problem. Same thing in bipolar disorder. I'm not going to belabor the point here. And they were unaware of the signs and the symptoms of their illness as well. I mean, it's really a remarkable number of people don't understand they're ill. And the lack of insight is a trait of the disorder. So the person gets treatment, and we think, oh, they've developed insight. Actually, what they've developed is common sense. Yes, Dr. Amador, I have schizophrenia. I'll fill the prescription. I'll come back next Wednesday for my appointment. Okay, patient has developed insight, has agreed to treatment plan, discharge Thursday, October 15th. I would write those notes all the time, playing along with the game, not realizing I was doing that. Playing along not with, when my brother used to lie to me and in the hospital say he had mental illness, and then when he came out said he didn't, I'd be angry. But what I realized is he did what I would do and what any of you would do, I think. And I'm going to bring this alive in a minute. It's common sense to say you have mental illness even when you don't think you have it, because it gets people off your back. I mentioned I was co-chair of this section. What does that mean? It means the American Psychiatric Association gave me $100 to work for 2 years. Not kidding. I'm not complaining. Right. The text in the DSM, not the criteria, the text, were all written by one person prior to 1999. So for 2 years, Dr. Michael Flaum, who's Commissioner of Mental Health in Iowa and also professor at the University of Iowa, we put together a panel of experts from around the country, around the world, gave them research literature to review, and said, let's revise the text so it reflects science, scientific consensus. So it took a couple of years, but we changed all the text in the DSM. So I just want to point to this one paragraph quickly, because it's going to save me about 10 slides, and then we're going to move quickly to the tools I promised I'd talk about. Evidence suggests that poor insight is a manifestation of the illness itself. It's a little wordy. What we're saying is it's a symptom of the illness, rather than a coping strategy. So this is not someone who knows they're ill but is in denial. This is a symptom of the illness, like a hallucination. It may be comparable to the lack of awareness of neurological deficits seen in stroke, termed anosognosia. Could you all repeat that once for me? Anosognosia. All right, one more time. Anosognosia. Beautiful, thank you. The reason I asked you to do that is people will come up to me and say, I heard you speak, or I read your book, and this whole concept is, I was talking to a judge about this, I can never remember how to say it. So it's a difficult term, and I'm sorry. But thank you for practicing it with me. What else did the science reveal? This symptom predisposes the individual to noncompliance with treatment and is found to be predictive of higher relapse rates, right? Person gets sick, violence. Actually, we didn't say violence then because we didn't have the data then. More hospital admissions that are involuntary, and poor functioning overall, and a poor course of illness. And today we now know it predicts violence. This was science as of 1999. The publication date of the last DSM was 2000, 9 years ago. So let's talk about anosognosia. Anosognosia is very similar. Anosognosia in neurological disorders is very similar to what we see in mentally ill people. So I'm going to talk about people you won't encounter very often, a neurological patient. I worked on a neurological ward for a year during my training. And my first assessment, I'll never forget, it's a classic description. This guy is paralyzed in the left side of his body. He had frontal lobe damage and damage to the motor areas of his brain, non-dominant hemisphere of his brain. So my assessment of his insight into his neurological deficits started with the question, can you move your left arm? He said, sure, I can move it. Please move it. Okay, you didn't move it. Sure I did. So I said, okay, well, you weren't looking. Why don't you look again with me and try? So he says, okay. I ask him to move his arm. It can't move, of course. He is paralyzed. You know, this side of his face is drooping. His left side is completely paralyzed. So I asked him, why didn't you move it? Now I'm thinking, this is when I was in training, and I'd never encountered this before. And until you see it, you can't believe it. I'm thinking, well, maybe he'll at least start to consider the idea that something's wrong with his arm, right? Instead, he says, no, I don't really feel like it. And a little light bulb, yeah, I didn't believe that one either. A little light bulb went off in my head. I remember sitting with my brother once, I don't know, 4 or 5 years into the illness, and laying out the evidence of his illness for him. Just like I was trying to lay out the evidence of this man's paralysis, I said to my brother, Henry, you always had work. You always had girlfriends. Very handsome, very popular, very sweet man. And you were always able to go to school. You were in college. You haven't done any of those things in 4 years. I mean, why do you think that's the case? And his response was, I just don't feel like it. And I argued with him. What does that mean? You don't feel like it, and you should feel like it, and you're 34 years old now. And a little light bulb. I'll never forget that moment with this paralyzed man, thinking this feels like not only my brother, but the many, many patients I'd worked with by that point in time. This is like 1988. So I asked him a third time, can you move your arm? He says, no problem. He goes to move his arm. He can't move it, of course. And he's still saying I can do it. He still thinks he's got no deficit. What happened? He doesn't want to tell me. So I'm encouraging him. You seem reluctant. Why? He says, well, you're going to think I'm crazy. I said, well, try and trust me. Why didn't you move your arm? And he says, because I think you've done something to it. He thought I'd somehow restrained his arm. So, I mean, this is Google it, Wikipedia it, it's there, you'll see it. It's a really amazing, how many of you have read Oliver Sacks' book, The Man Who Mistook His Wife for a Hat? Really, it's a small little book, and it's just stories of patients. It's really interesting. And when it came out like 10 years ago, it was a bestseller. Highly recommend it. It'll really give you a feel for what it's like to have different kinds of brain disorders. They talk about anosognosia in there a lot. So it's a very severe lack of awareness, right? He doesn't know he's paralyzed. The belief that nothing is wrong continues despite all the conflicting evidence. I've shown him 3 times. And he has what are called clinically confabulations. Confabulations, where there's a logical explanations he used to explain away what he was seeing. Because internally, he's like, I can move my arm, but his eyes are telling him his arm's not moving. So what were his confabulations? Anyone? Didn't feel like it was one of them. Anyone else? I did something to it. I tied it down. One more. He thought he could move it if he wanted to. Actually, it is a confabulation in a way. But, well, it's more evidence of anosognosia directly, right? The one that turned that light bulb on in my head, he didn't feel like it. I mean, he thinks that's the reason. He's not moving his arm. I just don't feel like it. You can imagine what happens in families when somebody with severe mental illness and the parents are saying, get a job, and you haven't worked and you're mentally ill, and the person says, well, I don't feel like it. I need a volunteer, and where's the wireless microphone? They had it up here for me. Just a short little role play. Any Bruce Springsteen fans here? Raise your hand if you're a Springsteen fan. Anyone? No? In this room? In this room? No way. There's just a song he has about sawing people in half. I'm not going to saw you in half. And okay, I'm going to be real specific, and I'm going to pick someone if no one volunteers. You can, of course, decline. I want a volunteer who's married, but you don't have to be happily married, just married. All right? They're all pointing at this guy. Mark. Your name is Mark? Hi, Mark. I'll shake your hand before I...
Mark.
Marty. I'm sorry, Marty.
Mark. No, it's Mark.
It is Mark. You want to come up? That's great. Thank you. All right. So, Mark, your friends or colleagues or both?
At one time, yeah.
Yeah. They put that close to your. So he said at one time they were his friends. They said that you're married?
Yes.
Okay, let's forget what they said now. So you believe you're married. Who is it that you say you're married to?
Yeah, my wife.
What's her first? That's tradition. What's your wife's name?
Maria.
Maria.
Yeah.
How long is it that you feel you've been married to Maria?
3 years.
3 years. Okay. How long did you know her before that?
3 years before that.
Okay. So 6 years you've been involved with Maria.
Yep.
3 years you've been married, right? I don't want to use her last name out of privacy and because of the videotape. Mark, the West Haven Police Department asked me to help you out here. How long do you feel you've worked with the West Haven Police Department?
West Haven, 2 years.
2 years, right? You're a police officer, right?
Yes.
Yeah. I've got some news that's going to be a little hard to hear. Okay. These really kind and I think compassionate officers are trying to help you. You've been coming to the police station. You've unfortunately gotten a hold of pretty close facsimile to a uniform and have convinced some citizens you're actually a police officer. That's problem one.
Mm-hmm.
You're not a police officer.
Okay.
Never have been.
Okay.
I mean, they're not shining you on. They just tried to keep you out of trouble. But you've way crossed the line when you put the uniform on. Okay? There's another problem. Can you wait for me right here?
Sure.
Okay.
Probably the gun.
I have in here, I think there were a total of 16 restraining orders. 16 or 17 from Maria. Not from Maria, from a judge. Complaints from Maria that you violated. Violations.
Okay.
Another reason that these men and women here wanted you to come to this event. And I'm sorry to take our time during this presentation to do this, but it's in the spirit of CIT that we help Mark. All right? Don't laugh. Stay with me. Would you like to call Maria to verify what I'm saying?
Not at all.
Not at all. Well, that's interesting, isn't it? Let's imagine you call Maria. Let me step out of the role play. And she says to Mark, "You seem like a nice guy. I never wanted to do those restraining orders, but my husband's going to kill you if you come on our property again." That's what she says to you on the phone. What would you think is happening then? Would you think you're mentally ill?
No, probably not.
Probably not. Would you think you were never married to Maria?
I wouldn't know what to think.
They all tell you can ask each of the people that you think you work with. You're not a police officer, Mark, and we really want you to, this is an opportunity. You can get some help here. There's no psych beds in West Haven. They've got one here for you. I got an ambulance right out there ready to take you to the hospital. Would you go? And they ask you that, and they confirm what I'm saying to you. Would you believe you're delusional about being an officer?
No,
Why not?
because I do it every day. I don't know.
But you don't. but you don't, and I can prove it, and I can prove it. Okay? Is your chief here?
No.
Yeah, that's convenient, isn't it? Okay, sorry, now I'm making fun. What would it take for me to convince you that you're not married to Maria and that you are not now, nor have you ever been, on the job? What would it take for me to convince you?
I couldn't convince me.
I couldn't convince you.
I don't know. I don't think
I've
so.
got restraining orders. You can go see an attorney. You can check them out, and the attorney of your choice says, "Yep, these are real, buddy." We can go to the town clerk where you think you were married. You can go up to the town clerk and ask them for a copy of your marriage license, and they say, "Sir, there is no license of your marriage to this Maria Smith." And you'd still not believe you were delusional? Okay. Thank you. Right. This This is the nature. I might hand the mic back to you in a second, but you can stay there. This is the nature of anosognosia. This is the nature of the belief that nothing is wrong. And it, it's, if I don't mess up my slide, it's solid, It's not like paper. I mean, this is like, he feels this in his bones. Is there anything I could do to convince him, or if this happened to you, anything I could say or do to convince him that he's not married and he's not a police officer? Anyone come up with anything? Well, let's say I insist you've got to leave right now. And the door opens and 2 uniformed police officers are there, and they say, "Sir, you got to leave. You got to leave. You're not welcome here." What would you do at that point? Try to put yourself in that place. I'm serious. The door opens, 2 police officers come. "Sir, you got to come with us." What would you do?
I'd probably ask him why.
"Sir, we'll discuss that out in the hallway. You need to come with us. They step up here. You need to come with us right now. One's here, one's here." And I'm sitting down now, and everyone's waiting for you to leave the room. What would you do?
Probably ask him why, just to get a reason why.
"Sir, we will discuss that in the hallway. Right now, you've got to get up out of your chair and move, or we will move you."
I guess eventually I would probably comply.
Probably just out of social pressure. It's
Yeah.
awkward, right? I mean,
Yeah.
the whole thing is ground to a halt here today, right? So he gets out there, and they say, "We want to take you to the hospital, to an ambulance." Now you're going to say no, probably, right?
Right.
All right. So you go home. You go to see Maria. She doesn't open the door. The police show up there. You're in violation of a restraining order. You go in front of a judge. The judge says, hopefully you have a diversion court, right? You can go to the hospital and avoid prosecution. What would you choose?
I'd go to the hospital.
You'd go to the hospital. Good. And they want to medicate you. And you won't take medicine for a week. And they say, "Well, we got to hold you here until..." Would you eventually maybe consider taking medicine
Yeah, to get released.
to get released? Would you might even consider saying, "Okay, I've got a mental illness"?
If that was
Can you
part
imagine?
of getting released, yeah.
Yeah, right. You see how it happens? Thanks. That was great, Mark. 5 years down the road, thank you. 5 years down the road, nothing's going to change. I mean, do you think his belief that he's married to Maria or that he's a police officer is going to change 10 years down the road? Think about that, folks. Anyone disagree? And if you do, raise your hand. Let's discuss it quickly. Do you think you could be convinced that some fundamental realities that you have are purely delusions, like who you're married to or the career you have, the job you have, right?
Not without medication.
Not without medication. Turns out medication doesn't even help that much with this problem, I'm sorry to say. That's why long-acting injectables are great. Instead of someone taking pills twice a day over 700 times a year, they've got 25 appointments, and the family and the doctor knows if the person doesn't take the medicine. But medication does not appear to improve insight. That's the bad news. The good news is we can get people in treatment and keep them there, and we can also, using the same tools, get people to comply and approach you in a different way than the hypothetical police officers I put in this room who are commanding you to get up and go.
What do we do with the client who is in treatment, sees a therapist twice a month, on medication, but continues to experience very high levels of paranoia and delusional?
Well, the question was, what do we do if someone is in treatment, and if you're sure they're in treatment?
They are.
Okay. And they're still symptomatic. That's about 30% of everybody with these illnesses don't respond. But I hope you're not blaming the people who don't take their medicine. I hope you're understanding now it's a symptom of the illness, and you wouldn't blame them for not taking medicine, because neither would Mark. Neither would I, right? The tools I'm going to show you that I'd like you to consider putting in your belt next to your cuffs and taser are communication tools that many of which you've learned, but there's going to be some others you haven't, because I know many of the core CIT curricula. You would use the same tools. So can I hold off on answering your question when we get to it? Okay. Yes?
Is there a percentage of people that suffer from this, or is it
From what? See, I told you.
anesthesia?
Perfect, thank you. Anosognosia. Percentage is about 50%. percent. Again, I didn't get into the research, but there's been research using neuropsychological tests, brain imaging studies. It looks like the brain functions differently. There's hypofrontality. The frontal lobes of the brain are not, it's sort of like a bad carburetor, back when we used to have carburetors, and you know, that needs to be, it's the best analogy I have. It's just, you know, it's running too lean, right? The engine runs rough, it doesn't work well. But about half of everybody. And these are the people you're encountering. I guarantee you that most of the people you're encountering are not like the scenario that you've just described, someone who knows, really genuinely knows they're ill. There's a difference between, Mark would learn to say I'm ill. I would learn to say I'm ill if this happened to me. I knew I wasn't ill, but it gets everybody off my back if I just play along for a little while until the door is unlocked and I have my freedom and I can do what I know I should do, which is not take the medicine. So when dealing with anosognosia, or let's call it poor insight, you know, the command and control approach is not going to work, not that well anyway, especially if the person has delusions about me or is hearing hallucinations about me. Don't go with him. He's one of them. Don't go with her. She's an alien. She's going to liquefy your brain. You know, voices are saying that to the person as the officer's telling them what they have to do. And certainly the doctor knows best approach isn't going to work, you know, with someone like Mark. Can't expect him to be grateful, receptive, or compliant. What I can expect is he's going to be frustrated and angry eventually, and he's going to be suspicious, if not paranoid. I mean, what would you think is happening? I mean, it's 5 years from now. You've never worked as a police officer. I'm sorry to keep picking on you, but are you okay with this?
Yeah.
Okay, thank you. It's 5 years from now. You've never worked again in West Haven Police Department or any police department, and you've never seen Maria again. What would you think caused this situation you're in?
People that I work with leading me on. I don't know.
Real loud.
Leading me on, telling me that I was.
They set you up for all this?
Yeah, yeah.
Why would they do that?
I don't know.
What's your theory? It's 5 years from now. It's 2014. You've never worked as a police officer. You've never seen your wife. What would you think they did this for? What reason?
I don't know.
What was that? Wanted him to stay in Orange?
I have no idea.
You don't know. But you'd probably start to develop things. You'd probably start to develop theories about it. I mean, I've heard people, I'm trying to give you a feel for how paranoia develops. Because you're trying to understand what the heck is happening, and you come up with these ideas that are just outlandish to most people. Conspiracy against me of some kind. You know, I mean, we're kind of laughing about it, but this is what it's like for the person. And we can also expect Mark and the people that you're encountering who lack insight, and again, I believe it's the majority of the mentally ill people you're encountering. I believe that's what the research indicates, and that's certainly my experience. You can expect Mark and people like him, if this really was happening to Mark, to be non-compliant.